Assalamualaikum warahmatullahi wabarakatuh. I'm very grateful today during the 4th International Conference on Biophysical Technology in Dentistry, a virtual conference. Now I will present about comparison of open flap surgery with or without bone regeneration material, a case report. Introduction. Accumulation plaque for a long time in the apical area can cause intrabony defect. The development of bone defect determining the treatment option. Open flap debridement or OFD easier the access to periodontal structure. Combination technique of OFD and regeneration material can significantly reduce intrabony pocket depth. So the aim of this report was comparing OFD alone and OFD with regenerative material in the treatment of intrabony defect. Case report. Two female patients, patient A, age 44 years, and patient B, age 43 years, came in the Department of Periodontia RSGM Unhas in different times. Patient A chief complained that anterior and lower gingiva easy bleeding and feel enlarged. She has no history of systemic disease and she's not taking any medication. On the other hand, patient B chief complained that posterior upper gingiva easy to bleed and feel itchy. Just like patient A, she has no history of systemic disease and she's not taking any medication. Clinical examination of patient A. Probing on bleeding positive. The score of papillary bleeding index is 4. The probing depth measurement found 4 mm distal tooth 42, 6 mm mesial tooth 43. Meanwhile, clinical examination of patient B. Probing on bleeding positive. The score of papillary bleeding index is 4. The probing depth measurement found 3 mm on tooth 24, 5 mm on tooth 25, 8 mm on T26 and 28, and 227 has been extracted. Pre-surgical preparation of the patient A and B almost similar. The difference is the patient A performed periapical radiograph, then the patient B performed panoramic radiograph. The next step, their gut scaling and root planning. After that, the vital sign was examined by general practice. After get permission to perform surgery, we explain the step of the surgical procedure, and the last asked the patient permission to sign informed consent. Surgical procedure of patient A. First, disinfection with povidone iodine, then anesthesia administered to the working area. Circular incision from distal of tooth 43 to the mesial of tooth 33. Flap elevation was performed with respiratorium. After we can see the root surface properly, scaling, root planing, and curettage root surface. Then, irrigation to remove necrotic tissue. Simple interrupted suture was done to fixate the flap. The last step, cover the flap with the periodontal dressing. The surgical procedure of patient B. First, disinfection with povidone iodine, then anesthesia administered to the working area, circular incision from distal of tooth 24 to the mesial of tooth 28. Then, flap elevation was performed with respiratorium. After we can see the root surface properly, scaling, root planing, and curettage root surface. Then, irrigation to remove necrotic tissue. Next, applicate the bone graft on the defect. Then, the resorbed bevel membrane was placed over the bone graft. After the membrane set correctly, suture the flap with combination simple interrupted suture and figure 8 suture. The last step, cover the flap with periodontal dressing. After the surgical procedure, there are some surgical instructions for the patient. First, prescribe medication like antibiotics and analgesic for 5 days. Then, avoid mastication in surgical area. Next, gently brush, especially the surgical area. The last, rinse with chlorhexidine 0.12% twice a day. The treatment result: both patient A and patient B get better tissue healing with no bleeding on probing, reduce the score of papillary bleeding index, reduction on probing depth 2 mm on teeth 43, 26, and 28, and there were no complaints about gingival bleeding, gingival enlargement, and gingival itching anymore from patient. Discussion: comparison of the result of patients treated with OFD alone and the combination of OFD, bone graft, and membrane show that both techniques gave better results, although the combination treatment OFD, bone graft, and membrane gave faster healing effect. It's equal with Gupta et al. 2013, who conducted a study on 15 patients with a pocket depth of more than 5 mm, found that the OFD techniques resulted in reduced pocket depth, clinical attachment loss, and gingival recession. And Maizop et al. 2019 conclude that guided tissue regeneration, or GTR, with the use of collagen membrane and a bone graft is suitable therapy for intrabony defect, but the results of treatment with GTR are strongly influenced by various factors, including treatment control, smoking, the accuracy of postoperative membrane exposure, and the characteristic of the initial defect. This is also compatible with Nibali et al. 2019 in their systematic review article Group Studies, which is comparing regenerative procedure and OFD alone in the treatment of intrabony defect out of a total of 22 randomized clinical trials from 1,000 patients, found that regenerative procedure resulted in better clinical attachment level gain, decreased pocket depth, and bone gain when compared to OFD alone. Both techniques gave better tissue healing. Patient A, treated with OFD alone, had great tissue healing in 5 months after surgery. Patient B, treated with combination OFD, bone graft, and membrane, also have excellent tissue healing in just 3 weeks after surgery. Patient cooperation influenced periodontal treatment result. That's all my presentation. Thank you.